The Eastern Cape Health Department has clarified in a statement that the 100 scooters provided to field workers won't replace ambulances. This after the ministry received backlash from the public regarding the scooters for the health care workers. For more on this, I'm joined now by the Eastern Cape MEC, Sindiswa Gomba. MEC, good evening and thank you for your time tonight. Just for clarity, the minister, when you were launching on Friday, says these scooters will be used for the transportation of patients and medicine. The spokesperson for the Department of Health in the Eastern Cape says no, these are going to be for education, awareness and community outreach. They will not form part of the emergency fleet of the province. Which one is it?
Well, let us put it in perspective. The scooters are about primary health care. That's the first instance. And we are using them for COVID precisely because COVID got in the way of that planning and that development. The scooters in their nature, if you go back to what primary health care is about, is exactly going to be working with clinics majority of the time and the community health workers that are dealing in servicing the people of that clinic. So if, as and when it does happen, as they deliver their medicines, as they deal with other issues that are related to primary health care, would find, of course, a need to transport a patient from home to a clinic. That, of course, is possible with these scooters. But the scooters themselves are not a replacement of ambulance, by no means.
Did they have patients in mind when these scooters were built? Because, I mean, a patient who is in critical, for example, about to go into labor, considering the difficult terrain which you spoke about on Friday, that the ambulances can't navigate, how comfortable is this canopy that has been connected to this off-road motorbike?
It is for that reason that I also tested it by getting into it, because one would not want to actually say something is safe, also that it is comfortable without you getting in there. If you would notice that you have got two designs in terms of these scooters, and as you look at them is that they have a bed that you can lie down, a patient can lie on it, but also the hood can come down and you create some kind of a gazebo, which then would actually be creating a buffer in terms of the weather out there. But when I look at the scooters, if you look at what is happening now, that part, the wire part, is where there is storage of all equipment that could be used, starting from a stethoscope, your measurement, your child scale, your infant scale, all those. Those are equipment that has equipped the particular healthcare worker, coupled, of course, with a nurse sitting where I was sitting. That would be doing those, even if it's immunization, they would go together. If the healthcare worker goes alone, those would be issues of dealing with delivery of medicines, and, of course, what we normally be doing in terms of our HIV and AIDS 1990.
How much is this unit going to cost? Or has it costed already?
These units, the 100 units that we have bought, are costing the department 10.1 million. And in that, each unit is ranging at about 94. The rest of that, to make it 100 or 101, is on the basis that it has alleged a 3-year maintenance contract. And that 3-year maintenance contract is, 1, on the basis of the mechanization, 2, on the basis of ensuring that there's equal training of whoever is going to drive in the districts. So that package includes training, maintenance of those scooters, and it all comes to, for the 100, 10.1 million and some few rands, of course.
As the department, you believe that is an investment worth making, 100,000 per unit of these scooters. And by the way, MEC, there are reports that there are 3 ambulances that are parked at service stations at this point because the department has not paid for them. They've been serviced. They are ready, some of them with close to 30,000 on the clock. They are sitting there, they are not serving the community. Yet you have paid 10.1 million for these scooters.
I would not be the right person to answer that question, precisely because I'm not an operative in terms of the distribution of ambulances and the acquisition. As you would know, your PFM does not get me into that area. The fact that I know the cost of the scooters is because of oversight. On what you are talking about, I will have to go and check on it.
But as the MEC, when you hear that, do you think that would be a correct thing to do? Would it have been a proper investment to put in 10.1 million when there are 300 ambulances that are parked and have not been paid for after service?
For me, it is. It is an investment if you know the Eastern Cape and what currently is happening. People in the Eastern Cape are ferried by wheelbarrows, are ferried where people make it, where you take the base of a bed, those beds with wires, that people would be fetched in such, taken to clinic in such because of the territory, because of where the person is. But even if that person would have to be assisted to get an ambulance, that ambulance would not be able to get to that home. As such, people must make means. My view, and the view when we're planning about these scooters in the department, is that they come in handy. Secondly, it is not an item we've not researched. It is an item that we've looked in the entire Africa. Majority of countries are using this, as we also copied it. And when I saw this exercise from Rwanda, I saw it working. You would notice that in one of the pictures of the research that we managed to get in Uganda, a pregnant woman rushed to a clinic, is put on the scooter, taken into that clinic, but that woman comes to the clinic safely, delivers the baby safely. Yeah. So Eastern Cape is faced with a lot of litigations in exactly in the same area. So if it does happen that the healthcare worker gets to a place with a nurse or whatever, and the issue to deal with that patient is beyond them, they will be able to rush that person into a clinic.
So these are war-torn countries. Uganda normally uses these as a response during wartime to be able to ferry those who are injured to and from those places because of the circumstances at the time. So are you saying that temporary measure is going to be a permanent feature then in the Eastern Cape health system?
When you are having challenges, in particular, when you have got a weak system in terms of your primary health care, you try whatever else that you want to believe at the time can work. The scooters for us, as we're sitting right now, a majority of people, as people are saying, they don't like them, they don't want them to be better this, to be better that. And when we discussed the matter, we thought it would be villages that would dump them. We are shocked that the majority of the DMs, in exactly where there are towns, are saying, we've got challenges that we have not looked into MSC. These scooters could come in handy. Remember, the Eastern Cape has got history of ambulances that are hijacked, in particular in Nelson Mandela, because they cannot get amongst the shack areas. And some DMs are saying, please come that we don't think we are in towns. We would use this because we've got shacks where ambulances cannot actually access to get to the people. And on the basis that healthcare workers, residential people within their communities, they do believe, some of them, that it would be easier not to be hijacked because there are no people in their vicinity.